I'm curious, where are the other companies other than Pfizer? Are you expecting them to come on later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID. He did a fantastic job with a lot of things. He's a leader, and Pfizer is right at the top. You know, it's there. Eli Lilly has been fantastic also, your friend, my friend. And they're all coming in over the next week. We're making deals with all of them.
Thank you. I'm curious, where are the other companies other than Pfizer? Are you expecting them to come on later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID. He did a fantastic.
Alors, so the interview will be in English. You saw what Trump said about Burla, the CEO of Pfizer, with yes, a gift of $70 billion. We'll talk about it because many people about this news were mad about it. With reason, it's like a betrayal. And to talk about this, is it a major? It is a major issue. So I will have with me Nicolas Hulscher. Thank you, Nicolas, to be there.
Yes, thanks for having me.
Yes, I thought it was important to having you because I saw your post and many other people talked about it. So you were mad about this announcement. I think we need some clarifications about what you think it is and what's the deal behind that, you think?
Yeah, this was very, very disappointing. Most people in the MAHA initiative that I'm aware of are very angry with this and very demoralized, very upset, right? It has ruined lots of people's entire weeks, and it has set us back seemingly months or years in progress and what we thought we were going to achieve, which was accountability for the mRNA debacle. So now we saw with that press conference, with this agreement, it's $70 billion where Pfizer promised to pump into American manufacturing for more mRNA injections, for cancer mRNA injections, for obesity injections, for all this garbage. And so now that that agreement's in place, it does appear accountability is off the table. We have to remember what Pfizer has done in the past. It is a criminal enterprise. This is not somebody you want to be making a deal with if you want to make America healthy again, right? They have 107 documented penalties for criminal activities, fraud, bribery, kickback schemes, all sorts of horrible things. False advertising, and they paid up to $11 billion in these criminal penalties. So they're not a trustworthy public health partner, that is for sure. And so, yeah, this is really a slap in the face.
Yeah, and I will I will suggest maybe some clues about this kind of deal. Well, let's see. First, it could be for money reason, of course, money reason. Maybe to help Pfizer raise more money for the suing they will have to face sooner or later about the COVID mRNA and other stuff. The announcement at first was seen as as good idea. Like yes, the big farmers will pay more, will lose money with the deal, and because they will have to lower the prices of medication. So that's a good thing for many people. And in the MAGA movement, many people wanted so badly this mRNA vaccine. You know, if you remember, people asked for it, and it was seen as a yeah, we will have the solution to not be locked down for 5 years. So this is the first thing, the money around it. Do you sense it? And if I was the CEO of Merck, maybe I will be mad about saying my competitor received $70 billion.
Yeah. So there's a lot of things going on. Yeah, like you mentioned, this drug price reduction appears to be for Medicaid recipients, and so it appears drug prices may lower. We're now giving Pfizer tariff relief, and so they agreed to lower their prices. But the problem is that appears to be front, the front of the real prize that Pfizer was able to score, which was a expansion and solidification of its mRNA empire. Because if you read on Pfizer's press release on this, right, most of the focus is on how they will now be able to expand their so-called cures. And Borla even said that while speaking at the White House. He's like, now we can focus on what we really want to focus on, these cancer mRNA injections. So
Yeah.
that's very, very worrisome, particularly since we know just how much damage and destruction the COVID products have caused. Now they're given free rein, it appears, to kind of experiment and test out all their other Frankenstein shots on the population. So this is very disappointing.
Yes, and about the mRNA, the funds were cut a few months ago about the mRNA research. So people could argue, well, they don't suppose to continue in this way. So do you sense they will continue with the mRNA research on the United States or not? Because the funds are cut, supposedly, it's 1,500 millions, if I remember.
Yeah, they cut the funds for mRNA shots for infectious diseases. So those for respiratory diseases, those projects. So yeah, that was obviously a positive thing. And we know that people within HHS, don't want more mRNA technology. We know that, right? But what overrules that is the executive branch, which appears to be compromised by these biopharmaceutical complex, compromised by the technocratic, artificial intelligence-driven groups and individuals such as Oracle and Larry Ellison and all these people that want to make personalized AI cancer injections developed within 48 hours, right? So that was laid out last January, where Larry Ellison brought forth that next to President Trump. And so, yeah, that's what they want to do. And so cancer mRNA shots are still on the table, right? Those still will be developed. Nothing there has been canceled. And I know that cancer is a subject where everybody does want cures, right? We do all want cures. We want
Yeah,
stuff to work. What works now does not work very well because it damages the entire body. And so,
yeah,
but the problem is they're moving forward with a completely failed platform. We know it's failed. We know the platform, the mRNA platform, causes cancer. 2 studies just came out, increases risk of 7
yeah.
types of cancers. Why are these all of a sudden going to help cure it? It's just going to
Like
be
this
another
one.
scam.
Yeah, this is the thing. So all COVID vaccine increase cancer risk, and all COVID vaccines, all of them. So I think it's clear what we're seeing, and this is you see this is exposed on children's health defense. This is the platform that RFK supported. So, what's about RFK? We saw a picture of him. He wasn't happy, maybe with Bola thing. We saw his look, but what about it? 25.7% higher risk of cancer overall, both mRNA and non-mRNA. Also, 6 types of cancer, and 6 types. I think it's the beginning. Just to let you know, I lost someone with that one, a friend of mine this year with the gastric cancer, and it was he had a chance of 1 of 2 millions to got it, and after sadly his death, I heard about further cases like that, and for the gastric cancer in Quebec province, we are about 8 million people. So he was so unlucky to have 1 of 2 millions. I lost another relative, 4 relative in the last year and a half, and many strange things, and sudden cancer, non-treatments available, and yes, the study just came out. And what do you think? Did you have the time to review this study?
Yes, yes, I posted on both of these studies. So this was the second one. So the first one came out a few months ago. Out of Italy, they followed 300,000 Italians for 30 months. And that study found 23% increased risk in overall cancer hospitalizations after the COVID vaccines,
Mm.
as well as 40 to 60% increases in breast, colorectal, and lymphoma and leukemia and bladder cancer. So that was that first Italian study. And then, now this study came out, which was even bigger, over 8 million people. I mean, this is a huge study. They followed them
Mm.
not for 30 months, but for 12 months, for a year. And 6 different cancers were increased: breast, lung, thyroid, colorectal, gastric, all sorts of cancers. And then, the overall cancer increase was about 27%, which corroborated the Italian one. So it's very clear that these shots have unleashed cancer among the population, the world population, because it wasn't just mRNA that was carcinogenic. It was, as that South Korean study revealed, it's also the viral vector shots that are
Mm.
carcinogenic. Those had like a 40% increase in cancer risk. And that was AstraZeneca, Johnson and Johnson, right? So those appear to also be carcinogenic. So this is affecting most of the developed world that received COVID vaccines. Africa's not seeing any of this disaster.
Aha. So there must be lucky. There must be climate changes. Another thing to follow. I discovered this disease recently, progressive multifocal leukoencephalopathy. Maybe this is what my mother has. Progressive multifocal PML it's not supposed to be current, but now we're seeing many people having that, and it attacks the brain, and it's related to HIV-1 infection. Oh, interesting. What's about it? We know because, of course, we were treated as crazy nuts talking about that, about the genome sequences of HIV and stuff like that. But is it? I think we're beginning to see the link with that.
Yeah, for sure, for sure. And we also know we just put out a study. It's on the preprint server where we did identify over 60 serious safety signals for central nervous system adverse events after these injections. And what that means is those are all sorts of diseases of the brain and spinal cord, right? And we identified a lot of these safety signals were central nervous system infections, or at least that's what they're reported to in VAERS, right? So this is a phenomenon that is happening to large numbers of people, where they do get, after these shots, they get some sort of infection, they get encephalitis, right? That's been
Mhm.
that safety signal was glaring, right?
Yeah.
So inflammation of the brain, and then we also identified prion disease. There's safety signals for this protein misfolding in the brain, ongoing human equivalent of mad cow disease.
Okay. Yeah.
And
We have a raising that also. Yeah.
yeah, and so that's ties in likely why we see these white, long, fibrous clots in deceased individuals that the embalmers are pulling out. That is amyloidogenic, misfolded proteins within this white fibrous structures in
Mm.
people's arteries and veins. So so it's not surprising we see this also in the central nervous system. And then we also saw other things such as brain and spinal cord abscesses. So they get
Mm.
pus-filled lesions that are infected in the central nervous system. And so this is all indicative of blood-brain barrier disruption from the mRNA shots, because it allows all these pathogens, all this vaccine material, spike protein, mRNA, DNA plasmid fragments, all of this kind of busts through the blood brain barrier and enters the neuronal tissue. And that's why we see a lot of these neurological adverse events, including that demyelination syndromes. The myelin sheath is becoming degraded in the neurons, unfortunately, after these shots as well. So it's really decimating the neurological system.
Yeah, and if you want to see what kind of news we have in French, I will translate it for you. But what you just thought about the cerebral, maybe structure and veins, also the barrier. Look at what the propaganda in our French media are telling people. The COVID-19 uh, do an effect of février. So the veins are older than normal because of the COVID-19 and particularly on the women. So now they don't touch at all the vaccine effects here. So elasticity loss of sanguine vessels uh, is due to COVID-19. But it's because of that the people are suffering like COVID-19, not about, we have nothing in French about uh, effects on vaccine from vaccines. And also we even have a surge in Quebec province about a 13 years old boy who had a colorectal cancer now, and breast cancer of 35 years old. It's considered, well, we don't know what can you say about this? It's not you in the United States. It's different. I will talk about the CDC and FDA in a few moments. But for the rest of the world, do you have contacts with other doctors, other surgeons, whatever specialists around the world, in Canada or Quebec, or in France or Europe?
Yeah, we're in contact with some physicians and scientists from Canada as well as from Europe, from Australia, right? All of them, a lot of people do reach out to us, and we are collaborating with some, especially on some research projects, on some studies investigating these harms. So, people are concerned worldwide. Doctors and physicians and scientists worldwide are very concerned and want to really investigate what has happened, because the governments are not doing so. They're not doing so at all. Like literally, they're just trying to sweep all of this disaster under the rug.
Mhm.
And so
Yeah,
that's why we're in this horrible situation today, because we are forced to do all of the work, right? People
yeah,
with no funding, right? I mean, you know how expensive these large scale studies are. They're millions and millions of dollars. So, yeah, our governments really have to step up to the plate here, start helping people out. We need treatments for the vaccine injured. There are no established protocols by our agencies, not one, not one. They basically just leave the millions of injured in the dark and ignore them.
yeah. This is my second guess. Like, yeah, the political backlash that could happen if people knew really. I have a feeling that, in fact, many doctors know that, and the statistics are much worse than what we're seeing right now. Is it a probability? And they must hide it, otherwise it will be a catastrophic. And like you said on your account, yeah, well, we'll we'll give 70 billion to a company who created maybe cancers with the vaccines, and to correct what they did. So I think the statistic may be worse than what we're seeing. Is it a good assumption?
Yeah, there's more people sick than what we're seeing. Like, just take, for example, the VAERS system, vaccine adverse events reporting system. That's underreported by a factor of 30 conservatively, but it's realistically underreported by a factor of 100, because we know a Harvard study came out a few years ago, found one less than 1% of adverse events are reported to VAERS. So, we can multiply the total number of reports, which is over a million, by 100, and you'll get over 100 million different sorts of adverse events, injuries, disabilities, and deaths. So yeah, it's much more wide scale, widespread than people realize. And we also have to remember, you ask anybody on the street, or in a large group of people, it's usually somebody will know somebody in their approximate family, or themselves, or in their close family, that has suffered a serious adverse event from these mRNA shots, right? People, like, this has affected people, and so they will tell you it has affected them. There's only about 20% of the population that is still subscribing to the narrative and lining up for booster shots.
Yeah, and have you heard about Dr. Mackey's studies about treating cancer patients? And I know the McCulloch Foundation has a protocol to get rid of the bad things of mRNA vaccines. So I think you will be a solution, maybe, and Dr. Mackey and other people. We have to work with what we can.
Right, right. Yeah, I'm aware of Dr. Mackis. What he's doing is fantastic. He recently put out a study a few months ago looking at fenbendazole, the
Mhm.
cheap anti-parasitic in stage 4 cancers. It resulted in remission, complete remission or near remission in all three of these stage 4 breast cancer patient, and one had melanoma. I forgot what the last one had. It might have been prostate, but yeah, all three of these stage 4 cancers with a fenbendazole protocol, where literally the tumors just shrank into nothing.
Mm.
And so this is very, very promising, as well
Yeah.
as ivermectin. When they combine ivermectin with fenbendazole, that is absolutely appears to be very powerful in its potential anti-cancer activity, because we now have another study that looked specifically at ivermectin in cancer patients. And not only did they find it was safe, even if they're undergoing chemo,
Yeah.
but they also found that it has over 12 distinct anti cancer mechanisms in the test tube. It literally shrinks these cancers in the test tube. And there are widespread anecdotal reports of people experiencing remission with these protocols. So this is very, very important. And there needs to be large scale trials on this immediately. I believe the state of Florida
Yeah.
is starting to initiate some of these studies on ivermectin.
Exactly, and we had reports recently about the FDA suddenly telling people that, it's okay to take ivermectin if you have COVID. It was September 8th, 2025, this year now, and we were tagged as nuts telling that. In the past, of course, ivermectin was not efficient, although I know a person personally who is fighting cancer with the treatment. The other one, ivermectin and pendazole. Yeah. So is in remission from his cancer. That's a good thing. And I took myself ivermectin, and it was very efficient, rapidly. People, it's a cheap treatment. It's not the big pharma industry, maybe they don't want the treatment; they want again vaccine. And did you talk to the to Robert F. Kennedy after the announcement, or Dr. Malone? Because Dr. Malone was aware of that also. I'm surprised that they're a little bit shy to talk about it.
Yeah, they're afraid to talk about it. Even Florida Surgeon General Joe Ladapo was
Yeah.
kind of apprehensive in trying to talk about it. Because they are officials, right? They are government officials, and they don't want to lose their positions. So they're going to be very careful, which we obviously want them to be vocal, right, to change the outcomes of these disasters, but
Mm.
that is not the case. They're not being vocal. There appears to be radio silence on this disastrous agreement. And so they're not saying really anything about it, despite the severe backlash. So hopefully they can come out soon and really address our concerns. I think that would be very helpful and needed at this point, as they literally shattered the MAHA base in half. Right? I mean, they took
Yeah.
a katana and sliced it in half, and so they can't
Mm.
just ignore it. They have to start acknowledging this. What would make me happy is if they come out and say, "Well, we're still, I don't know, honestly. I don't know what'll make us happy at this point, but they have to address it." And they have to address the injuries and deaths and disabilities that Pfizer has unleashed among our populations, right? They can't just sweep that under the rug.
Mm.
And so all of this has to start being acknowledged, or we're never going to move forward.
Yeah, and like many people are saying, Tucker Carlson did an interview also about it. COVID-19, we must have accountability. Accountability must follow, but we don't see that right now, the accountability. The good news is anyone can sue the Pfizer or even the government. But again, I'm not so sure about that because they sign agreements between governments and big the enterprises. Well, telling there was no liability because it was an emergency. Uh, so I think it will be again a political solution needed. I don't know.
Yeah, they're just gonna claim, "Oh, we didn't know, right? We tried our best. We did what we had. We had liability protections in the Prep Act, right?" So yeah, they're just gonna claim all that stuff and say they didn't know. But the problem is they're not even acknowledging the mass deaths and disabilities, right? They're not. They're just pretending that literally didn't happen at all, and
Mhm.
so that's what's very worrisome, and they're just going to keep doing it, right? If they're just allowed to keep coming into the White House and shaking Trump's hand despite all of this harm, they're just going to continue to do it for the next disease. They're going to
Yeah.
do it for cancer. They're going to give more kids cancer, peddle them these dangerous experimental mRNA gene transfer shots for cancer. They're just going to continue to compound the problem, and trust will completely be lost if they continue to do this.
Yeah, and the CDC and FDA in United States doesn't recommend now the vaccination for example pregnant women. But I don't know if you were aware of that in Quebec and Canada. Yes, they're still telling pregnant women that it's safe for them to take the vaccine. What you have to say to these women before the thing, and probably the doctor will recommend the COVID-19 vaccine, and after that, why not a Tylenol?
Yeah, well, if your doctor is recommending a gene therapy product to you and you are pregnant with a baby, I would find another doctor because they are quite foolish, and I don't know how anyone could think that's safe at this point in time. We have now so many studies documenting many serious adverse events. We see miscarriage rates are way up. But most concerningly is we saw a study by Carmon and colleagues a few months ago that found the mRNA shots literally destroy 60% of women's primordial follicles, their non-renewable egg supply. So this genetic material gets into the reproductive system. It
Mhm.
crosses the placenta. That was confirmed in another study. So it literally gets into the developing fetus. And then this fetus starts to produce a non-human toxic spike protein and frame shifted non-human proteins, right? So all of this is horrible, and then the own body is going to start to reject this baby because it's producing non-human components, right?
Ah,
This is a very bad idea. Just that understanding that mechanism of how it works should prompt doctors to not recommend it during pregnancy, despite all the studies. But they don't care. They're under mass psychosis, and they want everybody, even 6 month olds, to receive these shots.
even in United States, they still recommend it for 6 months. No, this was a first deception, I remember. And Robert F. Kennedy recently was kind of proud of that. CDC vaccine panel votes to end universal recommendation, okay, for COVID-19 vaccines in a major victory for science. Big Pharma suffered a big loss to the year, but this was September 19, not so far ago. But now we're seeing like I don't know, they still promote it for 6 years old, and other people they're continuing to distribute them anyway. If they don't do research about new COVID-19 vaccine mRNA, they still continue to recommend it. But and again, in Canada and Quebec, it's fully recommended for people right now. So you thought about this one. So there was a decision. People were kind of happy, and then a turnover. You saw that, and did you have comments? Did you saw comments about this? this week, also from RFK, commenting that the decision to help Pfizer again. If they gave 70 billions to Pfizer, why they don't give many other billions to other company? So the pharmaceutical complex is well alive.
Yeah, the biopharmaceutical complex is well alive, but one thing we got to clarify is um, Pfizer's not being given 80 billion. Part of the agreement is actually Pfizer is pumping itself its own 80 billion into projects, into mRNA vaccine projects in America. So it's kind of like a weird type of agreement, but
Mhm.
that was part of it. And so we now will have a criminal enterprise funneling $80 billion
Ah,
in specific U.S. manufacturing of more gene-based bio warfare agents. Right. So
mhm.
this is very bad, anyways. But yeah, we're making agreements with the devil at this point, right?
Yeah.
That's what's happened. And some people claim this is some sort of 4D chess, where Trump's keeping his enemies close, and they're gonna,
Mm,
do something. But I don't see any indication of that, because there's just that's just hopeful thinking. Maybe I'm wrong. Maybe that is a possibility, and they're gonna all of a sudden expose them after having them, pump 80 billion into America. I don't know, but right now it's looking like a backstabbing of America.
Yeah, and with the biopharmaceutical complex, people must be aware of one thing. You talk about it a few seconds. Military, the military side. So this is my third view. I'm saying maybe for military purpose again. Sadly, do you think it's a possibility again that they want something to test, or they need something for biological war? Because, frankly speaking, China is doing it, Russia, and everyone is still doing it. We have the Fauci. We have the commission, and Fauci must acknowledge that there was financing the China laboratory, because it was not on the ground of United States. It was correct. Maybe Ukraine too, bioweapon labs. Um, Again, did you see something about this, like a trending or some clues about it from some professionals?
Yeah, we're still very concerned about these biological laboratories. We have to remember there's over 1,000 BSL-3 and BSL-4 biolabs in America alone, many of
Oh,
which are conducting gain-of-function research and modifying pathogens to better infect humans and better kill humans.
yeah,
Right?
yeah,
This is what they're doing in many of these labs. It's not just America, though. It's in Korea. It's in
yeah.
Europe. Right?
Everyone,
What was that?
everyone, many big countries are doing that. This is mad.
Yeah, this is madness. And we also see Gates Foundation and Clinton Foundations are funding many of these, particularly in Africa. They like to use Africa and India as experimental grounds to test their products, because they don't care about humans. And so we have that. And so, yeah, all over the world, they're still manipulating pathogens. It's so dangerous. And so all they have to do is open up their freezer, right? In any of these thousands of labs, open up the freezer where they have these modified pathogens and throw it, into a large population center, just like what appears to have happened with Wuhan, right? So this is
Yeah,
so dangerous. This has to be stopped, right? And that's why all these labs, there should be some coordinated international effort to literally get it going to these labs and ensure there are no traces left of modified pathogens to better infect humans, because they don't belong in existence.
no.
They simply do not. They pose too much threat. And so that's what we're concerned about. They keep talking about the next pandemic, the next pandemic. They've talked about the next pandemic for the past 3 years.
They're still talking about it, and even today, there's a warning about Minnesota measles cases nearly double as U.S. outbreaks continue, and there's the Frankenstein COVID-19 thing running again. So the World Health Organization is still present in many places. Bill Gates Foundation, Melinda Bill Gates Foundation. So and now we have this outbreak of measles again. It was it was not in the news in the 10 years ago. If there was maybe a major one, but anyway, it was so minor. People did not care about these kind of pandemics at this time. But now you're seeing it also like another preparation for a next pandemic.
Correct, correct. And they got all the pieces in place, right? The World Health Organization pandemic treaty, that's now captured a large amount of countries, right? So that went through. So when something else comes out, they have the regulatory constructs in place to deploy more experimental gene-based products, to deploy vaccine passport systems. Those have been installed during 2020, 2021. So they have all of this ready to go, and they will easily be able to control and track people and force and coerce people to take more gene-based products for a next pandemic or so-called pandemic. We don't know what they have planned, but they keep claiming that the next one will be very deadly and worse. Now, how do they know that? I don't know. Probably
Yeah.
because they're making them in labs.
Yeah, they're most prepared than we think. But the good news is we're still prepared too, because now we have a better network of people telling the truth, informing people, different of the mainstream media. We have to break again some barriers in the media streams. We're seeing that, so there's some cracks about it. And what's your current plan to finish about the what's your current plan to inform more people? What is your current work right now? But what we can do to break these barriers, and is there a way to do it better? Is there a summit coming soon? Something with McKellar Foundation, a Brownstone Institute, or whatever, or Freedom Summit? I don't know. Health Summit.
Yeah, there's many summits coming up. I know Children's Health Defense has a summit coming up
Mm.
in November, near the beginning, I believe, of November in Texas. But at the McCullough Foundation, we will be planning a sort of conference for next year. But the key thing is what we're doing here now at the foundation. We're currently preparing over 5 scientific manuscripts for publication, further exposing the harms of mRNA technology, and as well as the causes of autism. And we have a
Mm.
giant paper coming out on that shortly.
Oh.
And so we have a lot up the pipeline, and we just had a few papers accepted for publication after successful peer review. We put those studies already out. We disseminated those materials when they were on the preprint server, but now they're past peer review. These were censored off the preprint server, right? And this study had to do with genomic dysregulation after mRNA shots. They wiped it from the preprint server. That's unheard of. It was just accepted for publication in a PubMed journal. So that will be a big slap in the face to the criminal journal cartels that like to censor our stuff. And so we're making good headway, and we will continue to fight this battle until these shots are removed from and barred for human use. We will continue, and the best thing people can do is to just keep voicing your concerns. Don't, just because if you love Trump, right, but he does something bad, we have to speak out, even if you like him, right? Because when something's bad, if we just let it go, these issues will continue to compound. So, if he does something good, right? Yeah, we'll cheer it on. It's great. Like that autism press conference, they talked about vaccines for 5 minutes. That was great. now they're making a deal with the devil. So we really have to voice our concerns, and we can make a difference if a majority of us do so.
Thank you very much for your time. I know you're busy. Maybe you will have other interviews this afternoon or tonight on the many platform. Or is there some big media who called you to have your advice about it? MSNBC, CBS, or Fox, whatever.
No,
Do they-
no, no. Mainstream media does not touch these subjects very often at all, which is
No.
very saddening. Especially you would expect Fox News to kind of at least talk about some of this new stuff coming out because
Mhm.
it's that damning and that damaging. But they don't, because it appears they also do receive money from big pharma as well. So
Mhm. Yeah.
mainstream media cannot be trusted for health information at this point in time. So yeah, we're gonna keep pushing out the truth on alternative media. X gets the message out better than all of these mainstream platforms. It gets more views, it gets more likes, right? It appears not many people watch television with a TV provider often anymore. That's going away. The alternative media is where it's at.
Excellent. Thank you again. Thank you for all your work. And you can follow Nicolas on many platforms, even on LinkedIn. Congratulations, but because it's not easy on LinkedIn to talk about these topics. People are very sensible to that and sensitive to these kind of topics. It's not easy to talk about it, but you're doing it with the best manner you can do. It's fantastic to see it, and I think the message will go on, and we'll break the barriers. We'll continue to inform people, to share your work. Very important, massive work. You don't stop much. Congratulations again, and thank you.
Thanks for having me.
My pleasure, and we'll follow you, of course, to see other news. We'll talk again, and I hope to meet you in person in one summit or another one day.
Definitely. Look forward to meeting you. Talk to you.
Bye bye. Thank you.